Cervical cancer is the second most common cancer in the Indian women. Cervical cancer is the cancer which arises from the opening of the uterus, which we call as the cervix, and it is majorly caused because of infection from a virus known as the human papillomavirus. Human papillomavirus has multiple strains, and these strains are sexually transmitted from a man to a woman or a woman to a man. So, during her lifetime, a woman can be exposed to any of these strains of human papillomavirus, which cause infection. After infection, some changes happen in the cells of the cervix, which over a span of 8 to 10 years can convert into a cancer. So it is silently growing in the body and does not throw any symptoms, so we can call it a silent killer. Because till the time it is not advanced enough to cause bleeding and pain, a woman would not know that it is building up in her body. And more importantly, before the cancer buildups, there is a condition which is precancerous, which is also persisting in the body for a long duration. So how do we know it if it doesn't have symptoms? The best way is to go for screening. Screening is a test in which we take out these cells by a spatula or a brush and examine them under the microscope by a test called the pap smear. This test can show us that the cells are having precancerous changes. If there are precancerous changes, these can be treated very well on OPD basis by certain colposcopic procedure, and you will ensure that they are not getting converted further on into a cancer. Screening gives us a lead time of 8 to 10 years. So it is like stitch in time saves 9. If you're picking up it in time, you are curing it in time, and definitely a non-cancerous condition is highly curable. However, if a woman has not enrolled herself into screening, then mostly the symptoms which might happen after a time when the malignancy has built up is bleeding, which can be in many forms, either postcoital bleeding or increased number of days in the cycles or irregular cycles. So let not the silence win. Go for screening so that these tests can pick up these benign conditions well before they develop into carcinoma. And surely benign conditions are treated on OPD basis will not entail much physical morbidity to you as well.